New York, one of the world's most admired cities, has become the hardest hit by the COVID-19 outbreak. The city has recorded the most cases in the world with over 159,000 cases. The death toll there stands at 7,000. Despite the bleak state the city appears to be in, Governor Andrew Cuomo remains optimistic at the moment. He says there's been a drop in the number of COVID-19 patients in intensive care units. For more on this, our New York correspondent Pavni Mittal joins me. Pavni, good morning from our side. First of all, in general, nobody was expecting this to happen in New York of all places. The first case there was confirmed on March the 1st, and look at the numbers now.
I mean, it's staggering, and I think what's pretty evident is that New York's biggest strength, it's global, it's a global city. People from around the world, international city, people moving around, people not really staying in their apartments, that turned out to be its biggest weakness in the face of a virus that obviously knows no borders and is spreading like wildfire. And that's what you're seeing now. And like you said, the governor said that while the death rate is going up and you will see more people dying, the light at the end of the tunnel, if you want to call it that, is that the virus seems to have slowed in terms of the spread. So the rate of increase of positive cases is dropping. And again, even though New York has administered the maximum number of tests, everybody who wants to be tested still cannot get tested. So you still have a lot of unaccounted for positive COVID-19 cases, a lot of unaccounted for deaths. You have situations in which there are people who are dying at home, and now the National Guard is being asked to go and sort of collect bodies. People are finding it hard to conduct funerals. So you have a situation where the city is really mourning the loss of people, first people's lives, and now the other big question is about people's livelihoods. We've had people who stayed home for weeks, and what we're also seeing now is that certain classes of people and certain races, that is Latinos and African Americans, are the hardest hit. They're disproportionately hit. They're the poorest in society. They're the ones who have been exposed the most. They're the ones with the least access to healthcare. And that is going to be the next frontier. And that is something that the governor has said that he wants a lot of research on, and how we can address that problem. And it's not a New York problem only. You're seeing other big cities also reporting disproportionately higher cases of COVID-19 positive cases, as well as deaths in minority communities.
Now, Pavni, talk to us about, your governor's always been complaining in his press conference of the shortage of critical supplies in hospitals, PPE and so forth as well. And also talk to us a bit about the effect that COVID-19 has had on the police force and, the first responders.
PPE, I think, is a big concern because hospitals and hospital healthcare workers and hospital staff need that. So what we've heard from the governor is that we are good for the next few days. But of course, there are reports coming out that hospital staff feel that they will run short. But you have seen, donations coming in. You've seen companies that are saying, okay, we'll donate. Apple is saying we'll donate. You've seen, the state of Oregon said, we'll send you ventilators. And Governor Cuomo said, great, when you have your apex, we will help you out. So I think there is a sense that people, the state, it has been scrambling, but it's getting together. Another thing I want to point out is that what he said today, and he has been saying for the last 2 days, is that while we are in a situation that is not ideal, it's still far better than what was projected. So the worst scenario was hundreds of thousands of hospital beds would be needed. We're still in the tens of thousands in terms of need. So I think that's something that people are a little satisfied about, that, it's not as bad as the worst case scenario. So that's one thing. And the other question that you asked about first responders and the police, and that has been the sad story, that people who we really need the most are the ones who are exposed the most. And that's because we don't know too much about the virus. These are people who are scrambling. These are people who are doing their best. They don't know whether they can go back to their families, pass it on. There are lots of doctors, lots of healthcare workers, and a large percentage of the police force has tested positive for the virus.
All right, Pavni, we're going to have to leave it there. I mean, the numbers are just astounding at the present moment. 8.6 million people live in that city. It is the densest city in the United States. Maybe that's one of the reasons that it's been hit so hard by the pandemic.